Hey, everybody, I'm Jill Conway, and this is Secrets of Powerful Women, a show dedicated to celebrating and supporting strong and successful women and sharing their stories. So, this is a special show today because we're talking about the recent incredible announcement by the FDA on women and hormones and HRT. So, my guest, and you can see her there, Dr. Roxanne Carfora. She's a board certified anti aging, regenerative, and functional medicine doctor in New York. And she has been on the show before, and she knows hormones. She knows HRT like the back of her hands, bioidenticals. She's a fantastic doctor, and now she's also my doctor and my kids' doctor. So, Roxanne, welcome back to the show.
Thank you so much, Jill. Thank you. Happy to be here.
Oh, wonderful! I love having you. All right, so let's jump right into it. So, what does this mean? The FDA, a few days ago said they want the black box warning removed from HRT. So what does that mean? What does that mean? What will we see?
Right. So years ago, they said estrogen caused breast cancer. There's a lot of causes to breast cancer. And my response always was, if estrogen caused breast cancer, every 17, 18-year-old would have breast cancer, right? So it's really how you metabolize your hormones as well. So they lifted the black box warning of saying that it causes, quote unquote, cancer, which was based on studies from years ago. And they didn't discuss the positive things of hormones. So, again, estrogen has over 400 functions in the body, from vision to taste to smell to heart to gut health, all the way down, and brain. Brain is very, very, very high in brain health is estrogen. When women's estrogen declines, it's not only about hot flashing, because every hot flash, those brain cells are dying. So keep that in mind.
So what exactly then? I mean, they say hormone replacement therapy, but what exactly really is it? It comes in all sorts of forms, but what is it?
Yeah, so correct. So it's exactly what it says, hormone replacement therapy. So it's when women's estrogen, progesterone, and testosterone goes down. But years ago, they just gave you estrogen and they didn't balance it with progesterone and testosterone. Hormones have to be balanced. You can't just give one without the other, and you can't just give it without checking levels. It's very, very important. And also all the other things that count, like hormones work in an alkaline environment. So you have to eat a lot of vegetables for these hormones to work. If you're going to eat sugar and diet soda and all of that, your hormones will not work. And that's where people would get into trouble.
So that's very interesting, right? So I mean, at that point, because I know when I had gone to my OBGYN, they said, "Oh, get the patch," right? But I thought it was very strange that you could just slap a patch on and not know what my original levels were. So why don't they do that in your typical doctor's office?
Yeah, they're just not taught. And the thing, what I love, I was dancing around this whole week saying, oh, how great.
Yeah.
I love it. They released this. I mean, I was going, I'm so excited,
I
right?
saw that.
Started
Great.
singing
Yeah.
the song. I loved it, right? So, but I'm concerned also because those patches are estradiol. And we have three types of estrogens that are produced in our body. Estradiol, which is a stronger estrogen, which usually does attack breast and uterine tissue. So women with very high estradiol levels could have uterine bleeding, a fibroid uterus, cystic breasts. So that still goes because estradiol goes to that tissue.
Oh.
Estriol is a weaker estrogen. And that's why when we compound, we mix like this is a little mixture of mine, right? So we mix it according to what your levels are and according to how you're metabolizing that estradiol. So I'm a little fearful. I love the news. It's great news because it takes away the fear of women that are saying, oh no, am I going to get breast cancer? Am I going to get breast cancer? Right? So it takes away that fear. But again, you have to know what you're doing when you go and give a woman hormonal therapy. And again, it should always be estrogen, progesterone, testosterone. Now, a lot of the obstetrician gynecologists say, well, you don't need progesterone if you don't have a uterus. So if a woman had a hysterectomy, they'll say you don't need progesterone because progesterone is what makes the uterine bleed, right? But you do because every single cell in your body, from brain to taste to vision to heart to gastrointestinal, all of it has estrogen, progesterone, and testosterone.
Which I didn't realize. I never knew, I mean, foolishly, I guess, that we all had levels of testosterone and things like that in a female body. I didn't know that. So, like, when I got all my levels tested, I it was surprising. But my question is this, I mean, why isn't it a regular thing? And can it be moving forward, do you think?
It could be 100%. It has been a regular thing for many years since Suzanne Summers.
Mhm.
Everyone knows Suzanne Summers from years ago, and she really brought about the attention of women taking hormones.
Yes.
It's always about hormonal and nutritional balance. You can't
Mhm.
have one without the other. You'll
Right,
never feel good,
right.
So, and it's not only with hormonal decline in a woman, it's not just her disease. It really is a family disease
Mm,
because the family sees their mother or their wife just declining cognitively, declining in their sex drive, feeling miserable, may feel tired, exhausted, but also very anxious. Women get
mm,
very anxious. They can't sleep if they don't have estrogen. They can't think if they don't have estrogen. So, I mean, there are stories on top of stories. And years ago, when they were saying estrogen causes breast cancer,
mhm,
and they had studies that prevention of osteoporosis, prevention of Alzheimer's,
mhm,
we were told as physicians not to tell people that. Well, you know, I didn't do that. I mean, I've been pro
mm.
hormone for 30
Yeah,
years.
right.
So, I didn't do that because I knew the data. And I would tell people, well, the FDA doesn't want to say that it's approved for A, B, C, D, E, F, G. However, there are studies that show that your brain function gets better, your heart function gets better, also LDL cholesterol. As your estrogen drops, your LDL, lousy cholesterol, so L for lousy, goes up.
Mm,
That's why women are at a high risk for cardiovascular disease the first year that they go through menopause. And that was very significant. And that brought about the red dress month in
mm,
February for recognition of cardiovascular disease, still the number one killer. Now,
mm,
if you were monitoring a woman's estrogen, and again giving her either compounded or what have you, depending upon how she metabolizes it, LDL goes down and it's
mm,
cardioprotective. And I was so happy to hear about 3 months ago, they actually put it in the cardiovascular
mm.
annals telling people, yes, be pro hormone, be pro hormone. So we
Right,
started getting that news. The news has been out on my
right,
end anyway.
right, right.
My practice hasn't changed. I've been giving, hormonal therapy to many women, for many, many years. So, it's it's um it's an awakening for the
Yeah.
public, and I'm very happy that the administration released that because it had to be released.
Well, they did say, right, that it was more important and more critical, HRT, more critical than antibiotics for women, I think, or equal to, which I mean, if that doesn't wake people up, I don't know. My own family, my sisters, I have 3 sisters, all older, and 3 brothers too, but 3 sisters, and they say, "No, that gives you cancer." Just like you said, and I was like, "No, it doesn't actually. They lied." They lied. So why, I mean, at that point, why was that study manipulated the way it was, do you think?
Well, I think it occurred mainly because, again, estrogen was just given to women,
Mhm,
in particularly estradiol, which
mhm,
is the regular pharmaceutical grade. So
right,
that's your estrase, your estradiol patches.
mhm,
So I prescribe that to women, but I know their levels. If I
right,
have a woman with a very high estradiol level and fibrocystic breast or uterine bleeding, I'm not giving her estradiol. I'm
mm,
compounding it in a cream or sucking candy or a pill form
oh,
with estradiol, a little bit in there, and then using estriol, the weaker one, which also will give you the relief of hot flashing, vaginal dryness. Recurrent urinary tract infections is due to low estrogen. You don't have estrogen down in your woo-ha, okay? You're going to be dry down there. It
mm,
changes the pH. And when you change the pH, you're going to get bacterial infections. So I have 80-year-olds with estrogen inserts to
right,
prevent E. coli.
Right.
So it's, I think it just got where they didn't use progesterone with it. They didn't look at women's metabolism of it. They didn't look at genetics. So we look at the genetics also. So
Mm.
in particularly the MTHFR gene, that's a whole nother topic. But that gene, you need your B12, you need your folate to metabolize estrogen. You have low B12, low folate, you're going to have difficulty metabolizing estrogen. And again, dietary is key. So I think it was just like slapped on women. Here, take an estrogen. Oh,
Yeah.
you have hot flashes, you have vaginal dryness, you have decreased sex drive. Let's increase the dose. And
Right.
they kept on increasing the dose without knowing if the woman was metabolizing it. And I fear that that would happen again.
Yeah.
I really do. I fear, even though I'm very happy about of the information out there, we still have to check levels and know how a woman metabolizes these hormones.
Well, it's because it's so funny. Well, some doctors, we have to say some doctors do, right? Some OBGYNs do um give that prescription, that blood work, to the prescribe it to their patient, but mine didn't, right, until I came to you. And I tried, they wanted to slap me with a pill and all this other stuff and progesterone, but I didn't feel well on it and it wasn't doing what I was hoping to do. And I went and you know the story, but I was having chronic UTIs, chronic every month, and then they were trying to tell me, like, it was in my head or something like that, and then they said and I said, "No, I really do, and, like, it's painful," and they said, "Well, let's put you on a low dose of antibiotics, and you'll probably
Mm,
be on it for the rest of your life," and I
mm,
said, "No way, no
mm,
way," and then at that point, I found you, and everything changed. So let's talk about that because well, first off, I wanna go back to the UTI because I have another, what someone had recently said about it, but the bioidentical, what is the difference? And you mentioned it a little bit, but what is the difference between regular HRT and then the
mhm.
bioidentical? Because they're different, right?
So years ago, regular HRT was extracted from horse's urine.
Mm,
So to differentiate it, one was bioidentical, the one that was pharmaceutical grade was horse's urine. But the companies got smart, because they saw women saying, no, I want a bioidentical, identical to my DNA. I
mm,
don't want to put horse's urine or horse's DNA in my body, right? I want my DNA more plant derived and more compatible with human cells. So I'd say probably about 6, 7 years ago, they started, taking that away, the horse's urine, and they
mm,
started becoming like what the compound pharmacists were doing. Now, the compound pharmacists are pharmacists with extra training in how to do mixes. So back in the 40s, if you went to a doctor and you had a thyroid dysfunction, that doctor would actually prescribe T3,
mm,
T4 in the certain mixes. It's the same thing we do today when we compound your formula. It's according to your estrogen level, your progesterone, stresses in life, your dietary, your genetics, and also your vitamin and nutrient levels. Then we compound it according to how your body, again, is going to metabolize it. So one woman may have 40% of estradiol, another woman may have 20% of estradiol. So, and one woman may have testosterone, another woman may have no testosterone. Most anytime I give estrogen, except in very few cases, I'll always put progesterone with it.
right, right. Because that evens it out. That keeps the
Yes,
balance, right?
yes,
Yeah.
yes, correct.
Okay.
So,
And go ahead.
mhm.
Go ahead.
So progesterone, so estrogen, I think of it as like if you have very high estrogen in your body, I always say you'll be itchy, witchy, and bitchy, right? Get the hell out
Sure.
of my way. That's the person that slams the door. They don't want to be with anyone and they're miserable. And it really makes a very tough situation for the family.
Hmm.
Progesterone, on the other hand, when you're 35 to 45, that starts to decline. And progesterone's your Zen hormone. It's calming, it's relaxing, right? So now when you're 35 to 45, you're losing your progesterone. So you're also losing sleep. You're getting palpitations. Very often going to a cardiologist and going in there
Hmm.
and say, they come in here and they go, well, the cardiologist said there's nothing wrong. Well, there is something wrong. You're progesterone depleted. So again, when you do the levels, then you could tell progesterone, estrogen, testosterone, cortisol. your stress hormone. That has
Oh,
a lot to do with it as well.
mm.
Yeah.
That was my problem too. That
Yeah.
was high cortisol. But I
Yeah.
have to say, I recently, a few things, and we had a big conversation, but I recently started to really dial in, and I really listened to everything you say, and I dialed into the whole cortisol and what is triggering that with me. And what I thought was being beneficial was, fasting and having black coffee in the morning. And I had a functional nutritionist on the show, and she was like, "Oh my god, that's the worst thing you could possibly do." And here I thought I was doing good things, but then I stopped, and all of a sudden, I feel great. Like,
Yes.
I s
Yes. And the reason being with that is that coffee is very acidic. Hormones do not work in an acidic environment. So you're best to have like water with lemon or even tea, so it's something that's more neutral, especially in the morning.
Yeah, well, I mean, we keep learning, right? I don't know why all this
Yeah.
information isn't
Oh, yeah.
around. So another bit of information I was just sharing with someone I know about this, and we just mentioned it, but UTIs, and
Oh,
there
yeah.
could be chronic UTIs in women my age, 50s and up, certainly all the way to 90s, and older women get
Yes.
them, and then it can turn septic. Um, there was something we were talking about, and we had a urologist on too, about vaginal estrogen.
Mm-hmm.
And I just saw a video, and I wanted to talk about it, from Dr. Kelly Casperson, who quoted Dr. Rubin's study and said if every woman over 65 got vaginal estrogen and actually used it, it would save $13 billion a year preventing UTIs.
Yes. 100%.
I mean,
A
I,
100%. When your vaginal vault is so dry and cracked, and these are microscopic cracks, and the bladder is a muscle that lies right above, into the vaginal area and right above the uterus. And if you don't have a uterus, then your bladder is really right on the
oh,
vaginal area. So when they remove the uterus, the bladder lays above the uterus. When people have hysterectomies, that bladder is right on top. So it's very easy for that to crack, I'm going to say. So I call it microscopic cracks. So people will go to their doctor and they'll have some mild blood. So of course they have to go through the workup of the cystoscopy to make sure there's no bladder cancer, but 98% is due to low estrogen. And if they were on a little bit of estradiol works great in the vaginal area because less than 1% is absorbed in the body. So it's very safe in the vaginal area. And that's where we use a lot of estradiol, but also testosterone. Because testosterone, if you have low testosterone, it weakens the bladder. So these are women not only get recurrent bladder infections, but also they get leakage.
mm,
So I'll mix the estradiol with testosterone to make the bladder wall, muscular. So
mm.
that muscle, and then the estradiol for the pH balance. So
So,
bacteria can't grow.
for example, my mom's 90. Can I bring my mom, let's say, and can she get vaginal estrogen at her age without never having it before?
So the difficulty with when you're 80 and 90, and I do have 80-year-olds that are on vaginal,
Mhm.
you have to be very gentle with them because their vaginal area could be,
Paper thin.
scarred, closed, and,
Oh.
very atrophied and stuff like that. So, you could just give them a little estradiol, have them put it on their finger and put it right at the entrance. And then as time goes on, like go in a little deeper. So I tell them go in very, very, very tiny amount just to kind of get it softened,
Hmm.
and then they'd be able to, use that. Yeah, I love, I mean, my 80-year-olds, they're on it. My oldest one on
Oh,
bioidentical compounded hormones is 88.
wow.
So, and again, she looks like she's 60.
Hmm.
So it's important because you really do decline. Like I mean, I've been on it since I'm 45. I started like with a little progesterone and DHEA, and then as time went on, and I was fully menopausal, I went straight up on estrogen, progesterone, a little testosterone, and that's where I stand today. And
Mm,
I love it.
mm.
I mean, I feel great.
I remember watching, and you mentioned her, Suzanne Summers. I think she was on HSN or QVC or something, and she was talking about her book and about bioidenticals and how important they were. And I remember reading reviews, and people were saying she was crazy, like
Yep.
she didn't know what she was talking about. And I was like,
Yep.
well, she doesn't seem crazy, and when you listen to her, she makes perfect sense. So there's something going on here, you know.
Yes.
And
And I
you
do, yep,
yeah,
I honor her.
yeah,
I do. I honor her because she was the
yeah.
spokesperson, her and George Hamilton, believe it or not, for the
Oh,
movement of anti-aging and functional medicine. If it
wow.
wasn't her, her book Ageless,
Yeah.
that's the name on my
Oh,
window.
right. Oh, I
It's
didn't
in
even
honor of
realize I
her.
didn't realize the connection. I have that book. Yeah.
Yes,
Oh,
yes. So you read her book. I mean,
yeah,
God rest her soul. She did
yeah,
a great job on trying to push it out there against all odds. And the science was there. She
right,
was going based on science. She wasn't going on woo, woo, woo. She
right.
was going based on science.
It scared so many
Hmm.
people, though, when that black warning came out. I mean, so many people that suffered needlessly, you
Right,
know? It's such a
right,
shame.
right.
It really
Yep.
is.
And Suzanne Summers did have breast cancer.
Right, right.
And
Which,
most people know that. She
well, and
lasted.
right, and so and she still had those. She still got the hormones.
That's right.
Right.
And she got no treatment, apparently, from, what she had said,
Mm,
publicly, but she lived a healthy life,
mm,
in spite of. And again, estrogen doesn't cause breast cancer. It is the imbalance of those hormones,
mm.
and it's the metabolism of those hormones, and it's your genetics, and it's your dietary. So there's a lot of factors involved here for
So, I mean,
breast cancer.
sure. Is there anyone that shouldn't take HRT, that shouldn't be getting or using HRT? Any woman?
Well, even though the report was released about, that estrogen doesn't cause breast cancer, because there are other factors that
Mhm.
cause it, right? I still will not use estrogen in a woman who's being treated for breast cancer.
Okay.
I'll check her hormones, and usually what the oncologists do, they suppress the estradiol and they suppress the estriol, right?
Mhm.
Well, when I do their levels, sometimes they're not being suppressed.
Oh, wow.
So is it another factor? And most of the times it's dietary and cortisol, stress. So when you control that as well, your estrogen can metabolize better.
So how do you control your diet and, in that way to control the
Good old
estrogen?
Mediterranean, we have to
Oh.
look at the Italians, they don't have gluten in their diet,
Mm.
right? They eat well. They exercise by walking up and down those hills. We've become very, with additives, and it's
Yeah.
and our whole diet's acidic. Look at bread. Bread has bromine. Look at hot tubs. We go in hot tubs, they have bromine. You go in chlorinated pools, those are all acids, chlorine, bromine, fluoride for the teeth. This is all acidic, acidic, acidic.
Mm.
And once you change that person's acidity and the acid environment that these hormones are bathing in, you have better outcomes. And that's Mediterranean, eating vegetables.
Mm. Mm.
Veggie, veggie, veggie.
Oh, I did. So that's interesting. That's very so it really is all this beautiful symphony of everything, right? Everything we do and everything we eat. It's not just you can't just focus on one aspect of your life and say that'll keep me healthy. You really
That's
can't.
correct.
Yeah.
That's correct. And my mentor, Dr. Pam Smith, she taught us all this for many, many years. And that's what she would say. This
Mhm.
is an orchestra. And like you're the conductor. Okay.
Mhm.
So you're taking everyone's body
Mhm.
and you're orchestrating it. You're the one that has to look at what's going on, what's communicating with everything. You don't just give and then you're done.
Mm.
You have to again monitor.
Right, right. So what do you think will happen now that, I'm assuming that I know the FDA has instructed the companies to take off, the label, but what do you think will happen? Do you think that means once the label comes off, then every OBGYN will start prescribing it in a much different way or much more often? I mean, what do you think
Yeah,
what will
I
happen?
think what they're going to do is, and that's my fear, they're just going
Yeah,
to prescribe without looking at other things. So, women's health care is multifactorial.
right.
It's not just one item, estrogen. So again, we have to look at everything from dietary to digestion, to again, hormone balance,
Mm,
right?
mm,
So I fear that. And I think now women will feel more comfortable.
right.
Like
Right.
now that the word's out, it'll say, oh, okay. It doesn't mean you're not going to get breast cancer if you don't take,
Right. Right.
because again, that there's many factors that cause breast cancer,
Right.
so, I think we still have to be cautious and, do levels and make sure you're eating well, do all the right things for your health. Don't
Yeah.
drink like soda and Diet Cokes and all that.
Mhm.
Drink water with lemon, alkalinate the body, eat lean and green, chicken, fish, turkey, lots of vegetables. And then that sets up a nice hormonal balance.
When you say check levels, just for the person listening, what levels do you specifically mean? Not only hormones, but I think probably other levels too, right?
Correct, correct. So in your blood, you should have your B12, your folate, because that metabolizes it, your vitamin D, because D is a pro hormone and balances those hormones.
Mhm.
Okay. Your estrogen, your progesterone, your testosterone, your and your DHEA, which is your balancer for your cortisol. Those are the levels that when you do that and you look at things, look at liver function tests. So I always do like a regular blood work, which is your blood count, your liver function test, your cholesterol, your thyroid. So you do your basic stuff, but then you add that other stuff on top of it.
Right, right. Okay. All right. So so your advice to women who are still confused and worried and didn't really understand what that announcement meant, your advice to them would be what? Just go to the right doctor? Go see
Now,
you?
now no, like don't fear estrogen. Just make sure the doctor prescribing it to you is doing your levels and make sure you're doing the due diligence with making your body alkaline by eating well. Not
Right.
every woman needs hormones. Most American women do, but the Japanese
Mm,
women don't because of their
absolutely.
genetics and their dietary. Is very different than ours. So, yeah,
That's
just do your due diligence with your own health.
right.
Eating lean and green and doing levels. Know your levels. Know what's my estrogen, what's my
Mm.
total estrogen level, what's my estradiol level, and just be educated in that when somebody's prescribing you something.
So what if if you ask for that and the doctor doesn't prescribe that, blood test? What do you do?
Find another doctor
Yeah.
because they should be doing your blood levels.
Yeah.
Blood levels, and then people talk about saliva testing because certain, like in estrogen, estradiol, estrogen, a lot of times the blood levels are not good, but it's a baseline. You can use it as a baseline. You don't have to know every second of the day, but you could use it as a baseline.
Hmm.
And then there's other tests to check metabolism. There's the Dutch test
Oh,
that people use to check metabolism. That's usually done at a hematologist oncologist office. Not
mhm.
everyone needs a Dutch test either.
I
You'll get it just from like honestly history and blood levels.
Interesting. All
If you
right.
have cystic breast and you have heavy bleeding, you have a lot of estrogen and
Oh.
not enough progesterone, basically. So remember that cystic breast, uterine bleeding, you're estrogen dominant.
So, heavy bleeding, meaning clots and things like that.
Clots, fibroid uterus, endometriosis, these are all things that estrogen's gone array and you're not metabolizing it.
Oh my goodness. All right. So let's pause here quick. So much more to talk about. We'll be back with Dr. Roxanne Carfora right after this. Help me get the word out. You're listening to Secrets of Powerful Women. We'll be right back.
Hmm, great.
Hi, everybody. I'm Jill Conway. If you love what you're listening to, please like and subscribe to my channel on whatever podcast platform you listen to and on YouTube so I can keep bringing you these amazing women and sharing their stories. Thank you so much for listening. I hope you love it as much as I do. All right, welcome back. You're listening to Secrets of Powerful Women. Dr. Roxanne Carfora is with me. We are talking about hormones and HRT and bioidenticals, and she's already showed us what they look like. So if you're listening to this is also available on video, on Spotify, and on YouTube, so you can actually see what it looks like, because I knew I didn't know what they look like. And it's just a lotion, or you could just, you put that where, Roxanne? You put that where? On
You
your
put it on
arm?
the fatty portion of your arm or the inner thigh.
Okay.
I'm putting it on my hand now, but this isn't my hormones. This is just
Yeah.
a model to show. But it's just a simple one click, sometimes two clicks, and you rub this right on the fatty portion of your arm or your inner thigh.
So what happens though? I mean, I've heard so much about vaginal cream for your face. or
Oh, yeah.
estrogen. So I'm not
Oh, yeah.
vaginal cream. I'm sorry. Estrogen cream for your face. Can we do this? How do I get this?
Yes. 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 Actually, my nurse practitioner, her skin is absolutely gorgeous. I don't put estrogen on my face, but it's the same one that you put
Ah.
vaginally. It's
Oh,
hyaluronic acid, so it
yeah,
stimulates collagen production.
right.
And estrogen, you can put, like, if you're going to do one click, this is a vaginal estrogen. If you do one click like this, you can put it on your face. And my nurse practitioner, and usually people will do it like 3 times a week, not every day. Like, it doesn't have to be the source of where
Oh.
you're going to put your compounded formula, but we make it for the face. Yeah,
Oh,
it's
I was
awesome.
gonna say because I have that. I mean, I'm very honest with what I have. I have the vaginal estrogen mix, but I can't put testosterone on my face. Won't I be sprouting hair
No,
and
you
stuff?
can't put test on. No,
Yeah, yeah,
no, you don't
no,
want to put testosterone on your face.
yeah, yeah,
Although our muscles, interestingly, our muscles do drop as we get older. But no, we haven't tried testosterone on the
yeah.
face.
No, I think that might not be a good look. All right, so what we are back, and I wanted to talk about Um, we talked about vaginal estrogen. We talked about all this, and what I want to talk about first, I want to talk about PCOS, but I want to talk about before I forget, men and women's menopause and how they're affected because they do get affected. And my poor husband, what I didn't say and do against this poor man, and then you say something, and you're like, "Why did I say something like that? I don't. Where did that even come from?" So, talk to me about that. What women go through, and then how it affects men.
Yes, yes. So it affects men tremendously.
Mhm,
So men, I call them the forgotten breed when it comes into when a woman is going through
mhm,
hormones. So a woman just doesn't want to be near him. Number one, if there's vaginal dryness, forget the sex. It's just not going to happen. Okay. Number two, if your progesterone is low, you don't want anyone near you. That
right.
you'll have low libido, and again, you'll feel itchy, witchy, and bitchy because as the progesterone goes down, estrogen becomes more of the dominant hormone.
Mhm.
So men don't know what to do, and we don't know why women they become truck drivers. It's like, get the out of my way. I don't want to F it. And where does the F word come? We have no effing idea. Where the hell is this word coming from?
It's so
But
true.
anyway, we just curse. And
Yeah.
then the next minute we're like, oh, so what time are we going out to dinner tonight? So everything's supposed to be normal, right?
Yes,
And
yeah.
this, yeah. So men have difficulty because they don't know what to do. And
Mm,
there was a book written, and I forget the author, but it was many, many years ago. It was a man that wrote a book about whatever happened to my wife.
mm,
And it was all progesterone.
mm,
So again, progesterone is your calming, relaxing libido hormone, also controls your thyroid. So progesterone is so important. So when all those women years ago just got estrogen, so wonder like they slept in 2 different beds because they were just on estrogen and no progesterone. So imagine that, no libido and just being itchy, witchy, bitchy all day, right?
right,
But years ago, women had to zip their lip and just do what they had to do, right?
right, right.
So, and then men get very emotional because they feel that the woman doesn't want to be with them,
Yeah.
like sexually,
Yeah.
right? So they become depressed about that. And I always say with men, and I'm very frank with men, it's 2 things: finances and erection.
Mm,
And they want to please their wife with both. So when a man doesn't have finance, he lost his job, he's going to be depressed. If a man can't get an erection, he's going to be depressed. If he feels he has finances and erection, but then the woman is so vaginally dry, she's running away, he's going, what's wrong with me? Am
mm,
I fat? Do I have enough muscle? And it really plays this mental game on men. And I think when we realize as couples out
mhm,
there that says, okay, there has to be an education on both ends. And so often I'll give my female, I'll say, most of the time I've seen male and female together, but
mm,
I'll give the female a list of things and I'll say, just let your husband know, you're going to be better in about 6 weeks. And
mm,
I could almost promise you that, unless it's
mm.
something else, unless you can't stand his guts, but
Right,
you'll be better,
right.
just in reference to loving him again, having that progesterone, having that libido, the oxytocin that's released in your brain. It's the love hormone. So I really try to educate men about that. And when they come in
Mm,
here and they're depressed about their relationship, the
Mm,
first thing I ask, is she menopausal? Like, is
right,
she of menopausal age?
right.
And that may be also why male and female go for younger, partners
Oh.
and affairs because now
Yeah.
they're being satisfied in many ways. So that's
Mm,
another reason why women should definitely start hormonal therapy very
mm,
young age. I start checking them in their
mm,
30s,
mm,
correct that progesterone by the time you're 35, 45. When you get to 45, 55 and you're losing your testosterone and you're losing your estrogen, then you put that on board. There's a
mm.
lot of things that women could do. And I think once women are educated and men are educated about what the woman is going through, I think you'll see a lot of saved marriages.
Mm.
Because truly, years ago, we used to say if a couple is getting divorced, it's hormonal decline. Definitely.
It's so interesting because again, I'm 50. How old am I? 53, and I'm at that age, and it started a few years ago where so many of people we know, have started to get divorced, and it was like, wow, well, what has happened? What is different? They seemed like they were so good, but when you think about it, and I think about how I was behaving. And not really realizing, and just like then like you said, you question, you're like, what did I say? What did I do? Right. And you have nowhere to turn, and you just feel like a jerk, you know?
Yes. No, you're right.
Yeah,
And you want to turn to your husband.
yeah.
But then your husband is like, who
I
is
don't
this person? I
exactly.
don't. But you just like
Right.
yelled and screamed at me, and
Yeah,
you just like slammed the door, and you just like
yeah,
threw a pail at me or
yeah.
whatever. What
Right,
the hell, man? I don't like this person. This isn't my
right,
wife. This isn't. So
right.
I think really
Mm,
the understanding of, again, and you start to go through perimenopause when you're 35. So 35 to 45 is when we're dropping our hormones, and that's when men, or women will start to get like angry and not
mm,
calm. And yeah, it's a
mm,
problem. I hope that this FDA approval that estrogen doesn't cause,
mm.
breast cancer and it's other things. And, that it does make a difference in the conversation,
Yeah.
and I do believe it'll save relationships. I really do.
Well, when do men start to get tested for their testosterone levels, and when can they supplement?
Yeah. Well, I test them at a young age. Okay. Because dietary number one, when they eat a lot of starches and carbohydrates and they drink a lot, so
Mhm,
your liver is going to metabolize that alcohol first and that bad dietary first, and your testosterone is going to plummet. So one of the first things like that, when I see a kid, a young man, in his
mm,
20s to 30s that has low testosterone, I'll look at that. The other thing that causes low testosterone is sleep apnea. So if your husband's snoring and he can't, don't
mm,
forget he goes through hormonal changes too. So, you want to make sure he doesn't have sleep apnea because you have to correct the sleep apnea in order to correct
mm,
the testosterone.
mhm,
And men will drop testosterone anywhere from 20s all the way up to their 80s. And there are some
wow,
men, I have men in my practice, 70, 80 years old that are cyclists.
mhm,
They bike and
mhm.
they bike like many.
Yeah.
Those are the only people that I see that are the cyclists that have very high testosterones, which is great. And they're in their
Interesting.
60s and 70s, like naturally,
It's those
you
bike
know?
shorts maybe.
I
So
don't know. It's something there. It's definitely
right.
something there. Those sexy bike
Wow.
shorts. Yeah, it's something there. It's something that
Huh,
maybe with their stimulation or their blood supply and stuff like that and just aerobically fit,
hmm.
but they keep their testosterone up. But men
Interesting.
could get their testosterone levels done. It's a blood test. And if they don't fall in the category of their age group, like the younger you are, you should be like 900, 700 to 900,
Mm.
and I'm seeing kids that are 200. I mean,
Wow.
pathetic. But you
Wow.
change their diet, they lose the weight, insulin comes down, testosterone will work. They understand alcohol causes it, you know. But then
Wow.
men usually in their 40s, they'll start to drop their testosterone a little bit at a time. But
Huh.
if they're fit, they'll have testosterone forever.
Interesting. Interesting.
Yeah.
So I want to talk about PCOS because we've mentioned it and we've heard since COVID the numbers are spiking.
Oh yeah.
No COVID spike. Um, you know, um, pun there. But what is the relationship that you're seeing between PCOS and the time since COVID started and the vaccines came into play?
Oh, it's unbelievable, Jill, because this is one of my things I presented at a Vegas conference in February, because I used to see maybe one or two PCOS. And just so people out there,
Hmm.
PCOS is polycystic ovarian syndrome. Okay. And that is when women at a young age or older age, they're usually morbidly obese.
Hmm.
They grow hair on the sides or hair on the chin, hair over here, hair on the belly button, right? And they become insulin resistant and their cholesterol goes up and their insulin goes up and they develop diabetes. That's your conventional PCOS. Okay. And again, I would see 2 a year, you're able to control it, and the testosterone's a sky high.
Hmm.
Since COVID, the first 2 to 3 years, I started getting these young women, because again, I always do hormonal levels on people,
Hmm.
right? Including testosterone. I was getting testosterone levels of 60, 70 in thin, healthy, okay, women in their 20s,
Hmm.
usually the college age group and later. And this bothered me, really
Hmm.
bothered me, because I said, why am I seeing so many? They would see their gynecologist. They weren't getting a testosterone level done. Again, I do it routinely. They
Hmm.
were coming in here and I noticed all these testosterone levels are high. And, you know, put it out there. And I said, can it be COVID? Can it be the COVID vaccine? Well, Christine Northrup, who's an incredible, incredible, intelligent woman as well, who speaks and has been speaking for years in reference to hormonal therapy, just like Pam Smith,
Hmm.
years. You know, she said that the COVID itself, COVID virus, whether you're vaccinated or not vaccinated, that it attacks a protein. I believe it's the fusion protein in the uterus, and was making young women heavily bleed, or postmenopausal women that
Yes.
didn't bleed for years, all of a sudden were bleeding.
Yeah, that happened to my friends. Yeah. Yeah.
There you go. So
Yeah.
it's something there, but now it's not your conventional high cholesterol, obese, hirsutism, PCOS person. When I do a conference now, I put a very thin, my front desk person actually, a picture up, and I go, okay, who has PCOS? And they point to the obese one who doesn't have PCOS, and not her, because she looks physically fit, young, beautiful, doesn't have the acne, but they
Right.
start getting acne. So acne is a big trigger. So if you have high testosterone as a female,
Hmm.
okay, you're going to get acne is the number one thing.
But doesn't everyone get acne though? Or no?
No, this is pocky.
Oh.
Yeah, you'll see on the
Oh.
side of the face here, you'll get pock marks. And
Oh.
there are things we could do today with that as
Yeah.
well. But, you know, you want to get that testosterone down, because that testosterone being up causes other factors,
Hmm.
increases clotting factors, cardiovascular disease, blood clots. Like we've got to check every single female's testosterone moving forward. I don't know. I think it is related to COVID. You know, it bothers me that I'm seeing this and I've
Hmm.
reported it.
Hmm.
And all of them do, most, I'm going to say most, have high insulin levels with normal blood sugars.
Meaning what?
So their insulin is high, so their other hormones can't work as well.
Oh.
It's very,
Because insulin's a hormone.
yeah, yeah.
Insulin, yeah.
That's right. And if you have insulin resistance,
Yeah.
okay, insulin loves to store itself in fat cells. So these young, thin, fit women are complaining now, why do I have fat deposits on my belly? Why all of a sudden do I have cellulite? And they're in their 20s.
Yeah. Yeah.
I'm gaining weight. I feel anxious. I can't sleep. I have palpitations. Why is my hair getting thin? Why am I losing my hair? Why do I have acne? And then you do these levels, and not all of them have cystic ovaries.
Hmm.
So that's interesting to me too, because I do a pelvic sonogram.
Hmm.
So I'll see them with high testosterone with normal ovaries. So the gynecologist will say, well, they're just high testosterone.
Hmm.
No, no, that's
Hmm.
abnormal. You shouldn't be just high testosterone.
So what is
It's
that?
abnormal.
Right. So
And
what do you
these
do?
levels are high. These levels are high.
Yeah.
Normal is 20 to 25. We're seeing 60 to 80.
So what do you do in that situation? Like, what is can they be
Yeah.
treated? Can they be
Yes.
treated?
Yes. Yes. 100%. I'm very aggressive because I don't want that. So I do put them on medication. I put them on spironolactone. twice a day, monitor that testosterone, get that down, change their diet into like a non-insulin, Mediterranean. So
Yeah,
you're not
yeah.
spiking up insulin. And
Okay.
often I'll check their sugar with a
Mhm.
machine that's called a Dexcom or a Lifestyle. It's a little device that you put on your shoulder and it connects to your phone and you're
Oh,
monitoring your sugars 24/7. So this way, is something spiking it? What else is going on there? And the
okay.
conventional treatment for PCOS is birth control pills.
Right.
What are we doing if the estrogen is not being metabolized? Now you're giving that person a birth control pill. So spironolactone, straight up spironolactone dietary. And if they're starting to gain weight, studies are showing that the Mounjaro, the GLP-1s are working totally on everything across the board. And I've
Oh,
used that. Everything. Their estrogen's normalized, their periods normalized, their testosterone comes down just with the GLP-1. So I think there's going to be a lot of research you're going to see in the next 2, 3 years.
wow. So what's the spiral, whatever you said? What's the
Oh,
spiro something?
Spirone lactone.
What is that?
That's a medication. It used to be used as a water pill,
Oh,
but what it does is decreases what's called androgen stimulation, that's what's causing the testosterone in a female. So they're starting to produce male hormones, but the spirone lactone suppresses that.
so all these young women who, again, I know, my daughters, all so many friends, all the college kids that are saying something's up, something's weird, right? Um, is it? I mean, I think when you Google it, you get scared, right, because of what it says and what it can lead to, and infertility and all these other things. But there are ways. It doesn't always have to lead to that. It doesn't necessarily have to lead to infertility.
Correct. Correct.
Yeah, there are ways to
Correct.
manage it and treat it. Okay.
A
Yeah.
100%. The old conventional way was just put them on birth control pills and
Yeah.
metformin.
Yeah.
Until this day, metformin is a sugar medicine. Until this day, I'll still see people in my practice that come in and we're treated with just birth control pills and metformin. Wrong. Get the
Wow.
testosterone down with the spironolactone. Get that spironolactone, to work for that client,
Mm,
and then really dietary and GLP-1s. The
mm,
GLPs it's phenomenal. I mean, I have they normalize.
yeah.
So wherever that's going and
Mm,
wherever that COVID mix was, think of how all these things came about,
yeah.
right? So COVID comes out, and then COVID vaccine comes out, and then you
Mm,
got the GLP-1s, that were
yeah.
like, so now everyone's on
Oh,
a GLP-1, you know, I mean,
wow.
you just,
You
who
question.
knows?
You
Who
scratch your
knows?
head. You're right. This it
Who
seems a
knows?
little
But at
odd.
least there's cure.
Yeah.
It's there's treatment out there,
Yeah.
definitely to control it, and those are the treatments right now: spironolactone and GLPs,
So
and
I
good diet.
wow, wow. So it all comes it keeps seems it like it keeps coming back to that, right? It keeps
Right.
coming back to that, right? So Dr. Carfora, you are a functional medicine doctor. For people who don't know what that is, because a lot of people don't, what is it? And it is truly, as I told my daughter, if you're gonna go into medicine, go that route because that is the future, I think, across the board.
Yes.
Yeah.
So many years ago, so functional medicine was a movement, and the movement was really to look at the cell
Mhm,
in your body, every single cell in your body, and nourish it,
mhm,
balance it with nutrition. So Jeffrey Bland, years ago, Dr. Jeffrey Bland started that movement. Then anti-aging medicine came about.
mhm,
And back in 2000, 2004 to be exact, that all started to come about. So they merged. So it became functional medicine and anti-aging medicine.
mhm,
Then functional means the body's function, right?
mhm.
Lifting weights, moving your body. So a lot of chiropractors started using functional medicine. So then functional medicine, anti-aging medicine changed to anti-aging regenerative medicine.
Okay.
So now everyone out there, the new terminology is going to be precision medicine. So precision medicine, functional medicine, anti-aging, regenerative medicine, whatever you want to call it, is looking at cellular health. It's looking at your cell, replenishing it with its depletions of vitamins and nutrients
Mhm,
and hormones. It's
mhm.
always nutrients and hormones. And always, 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 dietary is first. What you put in, then you have to digest and absorb. Then it has to get into the cell. It's an amazing body. I wrote a book, The Angel's Gut, right? So Angel's Gut, the inside story. It takes you all through that of just how the body works. And then it becomes your athletic performance, right? You get enough hormonal balance and you get all of your stuff balanced in your body. That cell's going to feed you back in so many ways.
I think I want to have you back when we talk about your new book that just came out. We briefly mention it but I do want you back for that.
Oh, so the new book that I released is No Finish Line: Mastering Athletic Performance at All Ages. Because as we age, hormonal decline comes, digestive decline comes, these things decline, so absorption and cellular energy declines. But there's no reason for it to decline because if we detect it, right, at all ages. So that book, No Finish Line: Mastering Athletic Performance at All Ages, starts from when you're 20 and then takes it from 20 to 30, 30 to 40, 40 to 50. My oldest athlete in there is 94 years old. He still bikes in the park of Stony Brook every single day, 94 years old on the bike. I have several athletes in there that have given their stories that are just amazing, Jill. One of them are going to be on your show,
Coming up, yeah.
so amazing, amazing stories. So when you read that book, you'll get amazing stories and be really inspired by these athletes in there.
And why did you write it? Why did you put it together?
So great question. It was for my athletes. So I see a lot of athletes. I do metabolic testing. I try to maximize their performance. And one came into me, and I can't say the name, but you'll get to know in the future, and at 45 years old was training when she was younger and got hurt. And at 45 said, I want to get back there. Well, she's back there, and it's awesome because of hormonal and nutritional balance. Another one who had lymphoma and was given like, okay, boom, done. Now he's military, very, very in shape militant. Well, you could look in the book. He won another medal. He just did the Marine 250-year run and he got the medal. So, these are people that have gone through the obstacles. And I said, I got to get it out there because there's so many people that forget their mindset of being athletic when they're younger. Right. So I used to bodybuild when I was younger and stuff like that. And I forgot, like, hey, I have to get back there, or I want to get back there. It's if you want to get back there, but maintaining that through your life is phenomenal. So I
Wow.
did it in honor. I wrote the book in honor of the athletes I take care of. It was devoted to them.
Wow. And I
Yeah.
just want to say, I mean, if you're in New York and Long Island and you can get an appointment with Dr. Carfora, please do it. But what I think is amazing in functional medicine, I didn't know this before I met you in our circle, but functional medicine looks for the root cause and it doesn't just treat the symptoms, isolated symptoms. And that's the beauty of what you do, I think.
Correct.
Yeah.
Correct. It definitely is looking at the causes of disease. The causes of disease are the cells dysfunction and deficiencies. That's all it is.
Wow.
And people go, then aging is a disease. Yeah. If you allow it,
Wow.
when you think
Wow.
about it, replenish it.
Yeah.
The knowledge today in medicine with cell health, people talk about NAD, and get this, all of these things online and Facebook and stuff. You don't know what to believe.
Right.
Just get your levels checked. You eat well, make sure you're digesting, make sure you have B12, B6, get it in the cell. That goes into the cell. Magnesium turns the cell energy on. CoQ10 is what turns the switch on. You just have those things, you've got a functioning cell that wants hormones. And then you give it estrogen, progesterone, testosterone, getting your levels checked, and replenish it. You feel great.
Oh my
You'll
God.
feel great.
Isn't
There's no
she-
reason why we shouldn't feel great.
You're the smartest person. You are just amazing. No, you are amazing. She is an incredible person. She's an incredible doctor.
Thank you,
and
Jill.
she's going to be living a very long life and helping us all to live a very
thank
long
you,
life.
Jill.
As we
Thank
slap
you.
estrogen cream all over our
That's
faces.
it. Estrogen cream or doing some tri-lift or, all these nice natural techniques we have today.
Right. Oh my God. I love you, Dr. Carfora. Thank you so much for coming on.
Oh, thank you, Jill.
I want to have
Thank
you
you so
back.
much.
You're incredible. And again,
I'm here to educate,
Yeah.
really.
yeah, you're amazing. And you are educating so many people. So
Thank you so much.
thanks for coming on. And a big thank you for everyone listening. We're celebrating incredible women on the show, women like Roxanne Carfora. I hope you're inspired to pursue your own dreams, reclaim your voice, and dream bigger. Your voice matters, and your story can help others. I hope you join me next time, and thank you so much, Dr. Carfora.
That's beautiful, Jill.
Bye. Share this podcast with a friend. Take care.
Thank you, Jill. Thank
Bye-bye.
you. Bye-bye.